If you are over 60 and your legs often feel heavy, tired, swollen, cold, numb, or weak, this message is especially for you. Maybe your feet feel cold even when the room is warm. Maybe your ankles swell by the evening. Maybe your legs ache at night. Maybe standing too long feels uncomfortable. Maybe walking feels slower and harder than it used to. Many people are told this is just aging, that circulation naturally gets worse, that nothing can be done, that this is something you must accept. But orthopedic surgeons see this differently, and that difference matters. Poor leg circulation after 60 is often not caused by blocked arteries or irreversible damage. In many cases, it is caused by something much simpler: inactive muscles. Blood does not move through the legs by heart power alone. The heart pushes blood downward into the legs, but the return trip upward relies heavily on muscle contractions. This is called the muscle pump system. Orthopedic surgeons understand this deeply. When leg muscles contract, they squeeze the veins and push blood upward against gravity. Valves inside the veins prevent blood from falling back down. When the muscles relax, veins refill with blood. This cycle keeps circulation flowing. When this cycle slows, blood pools in the legs. Pooling leads to swelling. Swelling leads to heaviness. Heaviness leads to fatigue, and fatigue leads to less movement. And the cycle continues. After 60, this cycle often breaks down, not because the body failed, but because movement patterns changed. People sit longer, they move less, they avoid discomfort, they stop using the full range of their legs, they become cautious, and muscles that once worked all day quietly go to sleep. The calves are especially important. Orthopedic surgeons often call the calf muscles the second heart. That is not a metaphor, it is anatomy. The calves surround deep veins in the lower legs. Every time the calves contract, they squeeze those veins and push blood upward against gravity. When calves are inactive, circulation slows dramatically. This is why swelling appears after long sitting. This is why legs feel heavy at the end of the day. This is why feet feel cold. This is why discomfort increases at night. Walking helps because it activates the calves, but many people over 60 cannot walk long enough or frequently enough to restore circulation fully. That is why orthopedic surgeons focus on one simple movement, the most direct way to turn leg circulation back on: heel raises, also known as calf pump activation. This is not a gym exercise. It is not aggressive. It is not painful. It is anatomy working as designed. When you lift your heels slightly off the ground, your calves contract. When you lower them slowly and completely, blood refills the veins. That is one pump. Each pump pushes blood upward. Each pump reduces pooling. Each pump improves oxygen delivery. Each pump warms the feet. Each pump reduces swelling. Each pump supports nerve function. And because this movement is gentle, it can be done frequently. Frequency matters more than force. Orthopedic surgeons do not recommend this exercise because it is impressive. They recommend it because it works. It is used after surgery, during long flights, during bed rest, during recovery, for swelling, for circulation, for comfort. Now let's talk about how this exercise should feel. It should feel safe, controlled, predictable. You can do it standing while holding onto a chair or counter. You can do it seated if standing feels uncomfortable. The movement is small. You lift your heels just enough to feel the calves engage. You lower them slowly and completely. You breathe normally. You do not rush, you do not bounce, you do not strain. This is not about building big muscles. It is about waking up circulation. Many people make the mistake of thinking harder is better. For circulation, that is not true. Gentle, rhythmic contractions work best. They calm the nervous system. Stress tightens blood vessels. Fear tightens muscles. Aggressive exercise can increase stress hormones. Gentle repetition lowers them. That is why this one exercise often makes legs feel lighter almost immediately. The nervous system relaxes. Blood vessels open. Flow improves. After 60, the veins lose some elasticity. Valves become less efficient. Blood has a harder time moving upward. That makes muscle activation even more important. Without muscle contraction, circulation struggles. With muscle contraction, circulation improves. Many seniors notice changes quickly. Feet feel warmer. Ankles look less swollen. Legs feel lighter. Night discomfort decreases. Walking feels easier. Confidence improves. These changes are not imaginary. They are physiological. Blood is moving again. This one exercise also improves balance. Calf strength plays a major role in stability. Better circulation improves nerve communication. Better nerve communication improves coordination. This reduces fall risk. Poor circulation is not just about discomfort. It affects how safe people feel moving. When legs feel unreliable, people move less. When circulation improves, confidence returns. Movement feels safer. That safety signal matters deeply. This exercise does not cure disease. It does not replace medical care. It does not diagnose conditions. But it supports one of the most fundamental systems in the body: circulation. Life depends on flow. When flow slows, systems struggle. When flow improves, systems recover. Your legs are not broken. They are underused. Poor circulation is often a signal, not a sentence, a signal that muscles need reminding. And when reminded, the body often responds better than expected. This exercise costs nothing. It requires no equipment. It can be done almost anywhere. It can be done multiple times a day. That is why orthopedic principles favor it, not because it is dramatic, but because it respects the body. If you are over 60, your body does not need punishment. It needs cooperation. Small movements done consistently can change how your legs feel, how they function, and how confident you feel using them. Circulation improves when movement becomes routine again. Final message. If you remember only one thing from this video, remember this. Your circulation is not failing you. It is waiting for activation. Your legs are not weak because you are aging. They are quiet because they are underused. One simple movement can wake them up. Not all at once, not overnight, but steadily. Do not underestimate small actions. After 60, small actions done daily are powerful. This one exercise is not about forcing change. It is about inviting it. Inviting blood to move. Inviting warmth back into your feet. Inviting lightness back into your legs. Inviting confidence back into your movement. Your body still listens, and when you give it the right signal, it responds calmly, naturally, faithfully.